Today we're going to start a series of videos focusing on the GPhC registration assessment. For those of you who are not aware, the GPhC registration assessment is the registration assessment for UK-based pharmacists to complete before they can be added to the pharmacy or pharmacist register. So I've been teaching trainee pharmacists how to prepare for the GPhC registration assessment for just over 4 years now, and we're going to start a series of free videos to help you get prepared for the assessment. We have a membership platform on www.micropharm.uk where we've taught over 4,000 trainee pharmacists to prepare for the registration assessment so far. So just to give you a brief background of what I do and my roles, my name is Yasser. I currently work as a visiting senior lecturer in pharmacy practice, an advanced specialist pharmacist in secondary care. So I manage patients with interstitial lung disease. I'm a visiting lecturer for the postgraduate clinical pharmacy diploma and also the director of MicroPharm. MicroPharm has delivered training to 4,500 trainee pharmacists so far, and I'm the national lead for trainee pharmacists for MORPH training. So in this video in particular, we're going to talk about the assessment structure. So the assessment structure for the GPhC exam is a two-part assessment, and you're expected to do both of the parts on the same day. The part 1 paper consists of 40 calculation questions where you will have to, where the answers are free-written. So essentially you have to calculate the answer for a question and free-write the answer for the question. And part 2 consists of 120 questions. 90 of those questions are single best answer. 30 of those questions are extended matching questions. So what do I mean by single best answer questions? So single best answer questions, you're going to have 5 options, and within those 5 options, you're going to answer with the option that's most appropriate. So there could be several options that are correct in the question, but one would be more appropriate than another. One thing that can surprise people is that in some cases, particularly when you look at sample questions for the GPhC, sometimes it's very evident that only one question is most appropriate for this particular case, this particular patient, this particular question. And that's not uncommon. So sometimes it could be just one that's appropriate in terms of the answer. But the single best answer format means that it could be a case where there's more than one question that is correct. The extended matching questions is where you would be provided a topic, for example, infection, and you've got 8 options in terms of answers. And when it comes to answering these questions, you may have several questions that relate to these 8 options, and each option could be either selected once, more than once, or not at all. So for this, you have 8 options, several questions relating to those 8 options, and each option the answer could be one of those options once, not at all, or more than once. For part 1, you have 2 hours to complete the paper. For part 2, you have 2.5 hours to complete the paper. A calculator is permitted for the part 1 paper. A calculator is not permitted for the part 2 paper. You may still get calculation questions in the part 2 paper, but those are expected to be calculated without a calculator. So this is the first video for today's session. In the next video, we're going to talk about the therapeutic areas that are covered and their weighting for the GPhC assessment.